Continuing Mobile Education for Emergency Medical Services Providers. Episode 3, EMS, Hospice, and Palliative Care. At the end of this episode, you should be able to define palliative care, define hospice care, understand the treatment goals for hospice and palliative care patients may differ, and be aware of situations where EMS may be called for these patients.
Hospice care is actually a Medicare benefit, which is restricted for patients who have a 6 months or less prognosis, so really is looking at the end of life. And hospice care generally focuses on comfort, not life-extending treatments. Mostly these patients don't get hospitalized unless needed for symptom control. And what hospice is able to provide varies widely regionally. Some hospice patients can receive treatments such as chemotherapy or radiation in certain localities. In other localities, it's more restricted.
Hospice care is end-of-life care provided by health professionals and volunteers. They give medical, psychological, and spiritual support. The goal of care is to help people who are dying have peace, comfort, and dignity. The caregivers try to control pain and other symptoms so the person can remain alert and as comfortable as possible. In other words, hospital is a special concept of care designed to provide comfort and support to patients and families when a life-limiting illness no longer responds to cure-oriented treatments.
Palliative care is kind of a broad field of medicine which really focuses on enhancing the patient's quality of life through medical treatments, psychological and spiritual support. It's kind of a 360-degree way of care. It's offered frequently in the end-of-life setting, but it's not just limited to that. We do deal with patients who have sometimes better prognoses or who may be dealing with a chronic illness such as heart failure, trying to really get their symptoms under control. Yet these patients don't yet qualify for hospice.
The goal of palliative care is to prevent and relieve suffering and to support the best possible quality of life for patients and their families, regardless of stage of disease or the need for other therapies.
In hospice care, again, it can vary widely. You do have lots of older adults, but then you can also have children and a lot of middle-aged population. Also, the level of function varies widely, although a lot of these patients are quite debilitated and relying on a lot of caregiver assistance. Cognitive ability can vary widely.
Hospice is certainly a different environment. Anybody that hasn't really been involved in hospice, it's hard to comprehend. I had some experience in an agency that actually was providing some hospice level care as a pilot type program. And you know, it really unfortunately depends upon the education that was provided to the family and the providers that are there. In all actuality, there really should be no involvement of pre-hospital care providers in somebody that's in hospice care. The whole idea is that they've reached the end point. There is no more medical intervention to be performed for this patient, and they're going into a comfort place to end their life. So we really had no protocols and no procedures to deal with somebody panicking, usually was the case, and calling 911 and they were gasping. Well, I don't have a protocol that says do half the stuff for a hospice person or not stuff for a hospice person, and it really puts you in a difficult situation.
I am a strong believer that you need to follow the staff's lead. I have a not so recent but still memorable call. The top floor of one of our local hospitals has a hospice, and I responded there, myself and my partner responded there to actually work what we call a 500 or a full code. When we got there, the situation had pretty much resolved, but in the time that 911 had dispatched my ambulance and the time that we actually arrived, the family had a discussion with staff saying that they didn't want the patient to go, that they didn't want to call it quits. And this is a patient that had been in the hospice program for 3 months plus. The family and the staff worked well together. The staff was extremely patient, but it ended up being something where it was a little contentious before we arrived.
Rarely are we actually called to a hospice home or hospice facility. Where we run into helping hospice patients is when they're remaining in their own homes and the family is uncertain as to whether they should call EMS, or if they do call EMS, what sort of care we're able to give. Because when we encounter hospice situations, it's usually the patient is officially enrolled in a program where end-of-life issues have been made. So we train our crews and we help educate the family that we still can help the patient in those situations, but in an area of resuscitation, that's where our limitations are going to be if the DNR orders are in existence.
To better work with hospice and palliative care in the field, always communicate with the patient and healthcare providers, utilize medical control, and understand the difference between palliative care and hospice patients. After viewing this episode, you should be able to define palliative care, hospice care, understand the treatment goals for hospice and palliative care patients may differ, and be aware of situations where EMS may be called for these patients.